Now we are going to deal about infants. Okay, 0 to 3 plus 3 to 6 infants. Okay, actually, when you are handling kid or infant, you cannot say it as kid, infant. When you are handling the infant, the posture will be little bit difficult to understand. Okay, certainly I'll give certain tips. It may be helpful. Okay, for example, if you are handling a baby or infant within 0 to 3 months, at the time when you are trying to hold the baby, how will you hold? Will you carry the baby like this? Will you carry the baby like this? How will you hold? Axilla. Actually speaking, we have to carry the baby with a cradle position. We have to keep it like this. But anyway, this is for our test. When we are carrying the baby at the axilla region, when you are holding like this, your this region, this lateral part of your palm, this region will be under the axilla, and the thumb will be pressing at the anterior region of the shoulder. And here, our fingers that will be cradling the scapula. So baby will be very small. We will be holding like this, right? So at this position, when you are trying to cradle a baby, and suppose you are sitting and you are keeping in the bed, you are keeping the baby like like you are making the baby to stand like this. If you are trying means, at the time, generally, what will happen, babies initially from 0 to 3 months, the kid will be floppy because the kid won't be straight, right? The second, as we have seen yesterday, the secondary cervical curve will not be developed because until now, the baby will not come to prone position. It will be in the straight supine position only. After that only, after some 1.5 months only, it will try to turn around, and then after 3 months only, it will be at the prone position, and then it will lift the neck. So the posterior secondary cervical curvature will be developed. So before that, it is not developed, right? So before that, when you are trying to attempt to hold like this or lift like this or keep the baby on the bed like this, so initially the baby will go for this because there will be only one curve, only general, only general primary C curvature will be there, vertebral column. Okay, it will be like this. So when we are holding like this, the baby will go down like this. Okay, it will be so floppy, and you will not feel any resistance, right? Because the same thing will come again. That's why I'm telling you, when you are keeping like this, the position will go down, and the baby will do this automatically with the floppiness, not stiffness, not with resistance. It will go like this. It tend to go like this. The head will, if you are keeping like this, the head will come in between our both hands. It will round like this. Body will bend, neck will bend, head will bend like this. Okay? This is one thing. Even though we are trying to keep it straight, we can have a choice that the neck may go posterior now. Why it is coming anterior? Because anterior, that means forward, is the general adapted position. That means flexor synergistic pattern. That is the adapted position of the kid from the womb itself, right? From the mother's womb itself, it will be adapted in such a position. So that naturally it will come to the flexor synergistic pattern. Okay? So with that position, it is maintaining and it is floppy. It is not developed spasticity, right? Suppose there is any abnormality at that time, can we find out, sir? Yes. Okay, I'll tell you later. After 3 to 6 months, what will happen? The primary curvature should develop normally. After that, when you are handling the baby, handling the infant, after 3 to 6 months, okay? At that time, when you are trying to hold like the same thing like this, and you are trying to keep it on the bed, the same kid, after 3 months, 3 to 6 months, what will happen, the head, it will not go down like this, it will straight like this, come straight like this, it will look at our face. Or it will look anteriorly towards us, and it will stop to play, right? So if you are holding it like this, so the baby, up the hands, that will be playing like this, it will be holding like this, or else it will try to catch our hands or something, or shoulder like this, and the head, what will happen? It will be straight enough, and not like this. It will be straight enough, and they will be trying to look our face or our shirts or button like this, our anterior region. So it will be like this. Okay. Suppose the babies, if the position is not maintained, right? Suppose if you are keeping like this, understand, at the initial stage, 0 to 3 months, if the position is not maintained like this, suppose we are 0 to 3 months, we are holding it like this, it should go down like this. Instead of that, you are seeing a baby that the position is going like this, extension. The neck is also so stiff and it is going for extension like this. What does it mean? That means it indicates some spasticity is there.